So 71 new cases today, and that means 494 Victorians now have coronavirus in this current active outbreak. There are 29 people who are currently in hospital. 9 of those are in ICU, and 5 of them are in ventilators. And those numbers have shifted significantly in the last 3 or 4 days. And we wish, of course, all of our very best wishes to people who are recovering from coronavirus at this point in time. We have 14,000 people as primary close contacts. Those numbers again have risen, in particular with regard to the Shepparton outbreak, and 9,000 secondary close contacts at this time. I expect those numbers to continue to evolve over the coming days. There are now 613 exposure sites across the state. I'll work through the numbers of the 71 cases in a bit more detail. 14 of those are associated with our Shepparton outbreak, and that means there are now a total of 36 cases in that Shepparton outbreak. We have 10 of today's cases associated with the Newport cluster, which now takes us to 61 active cases in that Newport cluster. We have 8 of today's cases associated with the My Centre childcare facility in Broadmeadows, taking that up to a cluster now of 50 active cases. And we have 5 cases in today's numbers associated with the Royal Melbourne Hospital, which now takes us to 10, the positive cases associated with the RMH. We also have 12 cases in today's numbers who are household contacts of previous cases that we understand well and know their mapping. But we also have 22 mystery cases today. That compares to 11 mystery cases we had yesterday and 10 the day before. That's a significant jump. And we're seeing again a spread into new suburbs in the Melbourne area. Suburbs like Essendon West, Camberwell, Thornbury and Fitzroy North, Maidstone, and then all the way down to Sorrento. It highlights again the points we've been making over the last few days, that we're now seeing an increasing number of suburbs and LGAs where we have active coronavirus cases. Of course, a lot of work for us to do on those mystery cases over the coming hours and days to understand those other linkages. Where we find one case, we are very likely to find more. And that shows the growing pattern of coronavirus cases, and so important, therefore, that not only do people comply with their isolation protocols, but for all of us, wherever we're living in the state, we need to be really aware that COVID can just be around the corner. We can still grab this and get hold of this and manage these numbers down, but that's going to require all of us to work together. In terms of the age profile of all of our cases, of the 494 Victorians, 112 are children under the age of 10. 100 are people aged between the ages of 10 and 19, and a further 79 are in their 20s. Again, it's a very, very young age profile of people currently active with coronavirus in the state. And what we've seen in this outbreak, going right back to the beginning, 2.5 weeks ago, we have seen kids get COVID. We have seen kids spreading within their families with a very high attack rate within their families, as the Premier just outlined with the example of some of the schools. We've also seen kids transmitting to each other. So nobody in this state is safe or immune from this, and I'll give some other examples as I go on. With regard to the Shepparton outbreak, we now have 3,753 identified primary close contacts, a third of whom have returned a negative test result so far. I can add my thanks to the fantastic work of the Shepparton community over the last few days, particularly Goulburn Valley Health and their teams. We tested 5,500 people on Saturday and Sunday at some very busy testing stations. We have even more testing resources being set up today in Shepparton. We'll continue to test as we work through this over the coming days. We have 3 schools now involved, Greater Shepparton Secondary College, in particular the Maguire campus, and around it's a large school, multiple campuses, over 2,500 people are now primary close contacts associated with the school. We also have a positive case associated with the Notre Dame Secondary School and St Mel's Primary School. And of the 36 active cases currently in Shepparton, we now have 8 households who are impacted in some way, shape or form. And again, I expect to see those numbers increase over the coming days. The cluster at the childcare centre in Broadmeadows is now up to 50. We have 1,200 primary close contacts. And of the primary close contacts associated with the childcare centre itself, 82% have returned a negative test result. That feels like it's starting to stabilise, and my thanks to everybody around Broadmeadows, particularly the operator of the childcare centre, for their very swift and prompt action, and of course that wider community of parents and teachers. Your support and active isolation will be very important over the coming days. We have no new cases today in the wider St Kilda clusters, so the work of the end of last week. I remain concerned about the number of loose ends we have around the St Kilda area. We still have our additional testing facilities up for a few more days in St Kilda, and again I'd urge the wider St Kilda community to come forward and get tested if they have any symptoms whatsoever or any concern around those exposure sites. Just because it doesn't lead the news doesn't mean it isn't dangerous for you in your locality. And then the continued concerns around Newport, 352 primary close contacts, 3/4 of those have returned a negative test result. I'm particularly appealing to really to younger men in the Newport area, Newport and Altona North area. If you're active in the community, if you're in your 20s and your 30s, if you're connected to the footy club, if you're connected to the gyms, if you're active in the community, please come forward and get tested. We really are concerned about this ongoing emergence of cases in the Newport area. We had some very good meetings last night with community leaders in the Altona North and Newport area, but please, we need to double down and really get to the bottom of what's going on within the Newport area. I thought I might just focus briefly on those who are ill and also our health services. So of the 29 people currently in hospital with COVID, 21 are under the age of 50, and there is one infant amongst those people. Within ICU, we have one person in their 20s, one in their 30s, 5 in their 40s, and 2 in their 50s. Again, a very young age profile for an ICU unit. Nobody who is in ICU has been vaccinated at this point in time. And then finally, in terms of our health services, we've seen a significant, over the last week or so, significant impact on our health services. And this is one of the challenges with more widespread COVID community transmission that we're now starting to see. And this is a scenario that we really need to pull up very quickly. We have a number of hospital, particularly emergency departments, who've now been impacted with COVID positive patients coming in off the street, including Mansfield and Wangaratta emergency departments, Mercy Werribee, we talked about that a few days ago, Footscray last week, the Alfred also last week, Sunshine Hospital yesterday, and of course the Royal Melbourne. And the Royal Melbourne case again shows you how rapidly COVID can move through our community. We had a patient who was taken into the Royal Melbourne, transferred from Shepparton on the 12th of August in for planned surgery. That planned surgery took place. She was in hospital for the entire duration and is believed to be the index patient for a coronavirus cluster that now includes 10 people, some nursing staff and 1 or 2 other patients, but also now has an impact of 450 staff being furloughed at the RMH. That is a significant impact on one of our most important and prestigious hospitals. The RMH team are doing a fantastic job in working around it. My thanks to them and the wider health services across Melbourne for their response to this. But it shows you how a relatively small number of cases can have a huge impact on our health services and the measures we'll have to take to measure that, to deal with that. In terms of dealing with that, from now on, there will be testing before all planned operations will require COVID testing beforehand. Those arrangements are being put in place now by all of our health services. Some have had that in place for a while. And all of our emergency department staff are now in Tier 3 PPE. The implications of that are that for every single emergency room staff member, they're now spending their entire shift in an N95 mask, in a full visor, and in protective gowns and gloves for their entire shift. That is a significant, it's an unpleasant, it's hot, it's hard work, and this is the implication of seeing these rumbling cases running through parts of our community. I would like to a huge thanks now to all of our healthcare workers. We now all have to step up again to deal with the growing number of cases we're seeing in the community and be prepared for these cases coming through. There's a lot of work happening in our health services, and my thanks to them, their leadership and their frontline staff for all their work they're doing to make sure we get through the coming days and weeks as well as we possibly can. Finally, in terms of vaccinations, as the Premier said, a record week last week, 185,970 vaccinations delivered through our 50-odd state clinics, and my thanks to all those vaccination teams for the work they're doing. 85% of those aged over 70 have now received at least their first dose of the vaccine. 78% of over 60s, or Victorians in their 60s, have received the first dose of the vaccine. For those in their 50s, 72% have had at least a first dose. And for those in their 40s, 64% have had their first dose. And can I add my encouragement to those of the Premier? If you've got a vaccine appointment this week, please use it. The Commonwealth has made it clear that there'll be wider availability in the weeks ahead for Pfizer. that'll just mean a longer queue for what is still a limited supply of vaccine to the state. We need people to get vaccinated now. We can see that we're seeing a growing number of cases every day. We're seeing mystery cases. We are doing all we can across the community to keep those cases under control, but there is no time now to waste in order of getting people vaccinated. My final message is, please, for everybody, please stay home. Do not go out. Do not mix in this environment where we have cases that are out there in your suburb. If you have any symptoms whatsoever or any concerns, get tested. And if you can, please get vaccinated.